All right, we are live. Hello, everyone. My name is Jake Pham, and I am in my last year of the Doctor of Physical Therapy program at USC, and I am in my last rotation. Let me add Lincoln as soon as, come on, technology work. And accept. There we go. All right, hello again, everyone. Okay, so we're all here right now. So if you didn't hear the first time, my name is Jake Pham. I am in my third year, my last year of the Doctor of Physical Therapy program at USC, and I am currently doing my second to last clinical rotation here at Reactive Physical Therapy. So we're taking over the Instagram tonight. With me, I have Lincoln Beal and Harrison Ngo. They are our, respectively, Lincoln is our Movement Disorders Fellow, and Harrison is our Orthopedic Resident. So tonight we're going to be just asking them questions about the whole process of, like, what is the fellowship? What is the Orthopedic Residency? How do I get involved? All right, so Lincoln, Harrison, we're about to take it away. So what is involved in both the residency and the fellowship program?
You want to start?
Yeah, sure. So for the residency program, there's just a lot of mentoring, about, for me, 4 hours per week. I'm also teaching twice a week at USC. And there's just a lot of things that go, and I do literature reviews at USC, and then there's advanced skills training also at USC.
Yeah. I think the one main difference, I guess, between the residency and fellowship is that his residency is through USC, and mine is really through just Reactive, the clinic, and also I spend a day once every other week at UCLA, so that's kind of like a partner in terms of the fellowship. Pretty similar structure. His residency is for orthopedics at a neuro clinic and teaching orthopedic specifically. I am more, it's kind of like a subspecialty within neurology. So a neuro residency might do more broad neurology topics, but I'm specifically specializing in movement disorders. So we both see patients a lot of the time, and my caseload is mostly movement disorders patients. When I go to UCLA, I work with the movement disorders physician, and we see movement disorders patients there. And yeah, so that's and I also get mentoring, but yeah, again, it's just a little more of kind of narrow focus compared to the residency, but similar structure.
Got it. So it sounds like, correct me if I'm wrong, you have physical therapy as the whole field right here, and then you got neurology, and then within neurology is movement disorders. Is that correct?
Yeah, exactly.
Got it. Dang, Lincoln, is like, you got all these questions ahead of time. Okay, perfect. So you mentioned that Harrison's orthopedic residency is through USC and yours is directly through Reactive, right? So is there a separate application process? Because you're both here at Reactive right now.
Right. Yeah. So for the fellowship, you can find the application on the Reactive website. And yeah, it's a separate application compared to the typical, I think there's like a standard place where you do most of your residency applications. Is that right?
Yeah, it's for the residency, you go through, there's an application from USC by itself, but then it's mostly ran through exactly like PT-CAS, where you initially apply for physical therapy school.
It's the Residency and Fellowship PT-CAS, correct?
Yes.
Perfect. If I can't remember exactly the website, but it's rf-ptcas and .com.org.
Will pop up. It'll be the first link.
Perfect. Okay, so this is to both of you. What do you like best about your current programs?
I think the best thing for me is that I really am passionate about movement disorders, and I get to really spend most of my time either working with patients, getting mentoring from experts in movement disorders specifically, and both physicians at UCLA and physical therapists here at Re+active, and that includes multiple different people who are also specialists in movement disorders. A couple have done the fellowship that I did too. So that's what I like the most about it. The other cool thing about the fellowship is that it's pretty broad, the type of things that you can get involved in. So there's a big community service aspect of it. So for instance, we volunteered at the Parkinson's Foundation Day recently. And there's also a little bit of education. I don't teach the same way. I don't teach physical therapy students the same way that Harrison does through the residency, but I get opportunities to do some courses through Re+active's education, or I'm going to teach a course at UCLA to some neurologists, for example. So there's some education aspects of it too that I like.
Yeah, and for me, what's unique about my residency is that I'm in a neuro clinic, but my main focus is the orthopedic side, the orthopedic management of things. Just really combines both my interests. At first, I was kind of leaning towards a neuro residency, but when I was a student here, they offered me or they just provided me the information about the upcoming ortho residency. So I was very fortunate to learn about it, and then I applied. And yeah, and so what's also really unique about my residency that I liked a lot is just the mentoring. Getting world-class mentors to kind of guide me through the treatment process has been the most amazing experience. So yeah, very grateful.
So you say the word mentors as opposed to mentor. So through the USC Orthopedic Residency, I don't know if it's through USC's Orthopedic Residency or if it's specifically the ortho residency here, that you get access to multiple mentors, is it?
Mm-hmm. Yeah, I get every week, or pretty much every week or every other week, I'll have a outside mentor from USC or a USC affiliated. So and that's also very unique to this residency too, which has been really cool to just see the different approaches.
Very cool. So does that mean here at Re+active, you have a bunch of different mentors coming in, but at some of the other sites, you don't really have that? Am I correct?
I think so. I'm not too sure. I know some clinics are more in-house, but then there are other clinics that are similar to the way my schedule works, where outside mentors will come in and help the resident.
Got it. That makes sense. I hear you. Okay. So, and then USC has what, 11, 12 orthopedic spots available? So each location is different. Am I right?
Yes. And then most of the clinics right now are just purely orthopedics, working with an orthopedic population. Some clinics will have a neuro, section where they treat neuro patients, but not too often.
Got it. That makes sense because it is an orthopedic residency after all, right? Lincoln, I'm going to bounce back to you. Why movement disorders specifically?
Yeah, I mean, for me personally, I was actually here as a volunteer when I was a PT student, and then I also so I volunteered for a while with Re+active and a Re+active patient with a movement disorder, and I came here as a student and did a clinical rotation here. I kind of knew I was interested in neuro, but I think that's when I really started to clarify my focus on all the different movement disorders diagnoses and the treatments, and it just became really like a passion. And so, it's just, yeah, that's kind of the main reason. I knew right from the get-go, working here as a student, that this is what I wanted to do, and it was kind of the perfect fellowship for me, I guess.
Oh, I love that. Yeah, what is it specifically about movement disorders compared to other neurological disorders?
Yeah, it's a good question. I mean, I think with movement disorder, there's so many reasons. I mean, we'd be here all night, but I think it combines a lot of aspects of like neurodegenerative diseases where you kind of form a lifelong relationship with the patient and their family. You kind of coach them through what to expect, how to manage all the different movement abnormalities that come up in Parkinson's, balance, moving slowly, having walking issues, balance, I said that, but like other movement issues. I think I really enjoy that process and getting to know people and their families. And the other thing is that they're just so variable and so interesting from a neuroscientific perspective. And I think it's kind of a field where we're really just starting to figure out what are the best type of treatments to manage these things. So it feels very exciting to be in a field that's kind of dynamic and evolving.
Definitely. So it doesn't sound like it's very mundane or monotonous. Like everything's dynamic, everything's changing, right?
Yeah, absolutely.
Oh, that's so cool to hear. And then Harrison, I'm going to bounce back to you. How do you see you using your specialized orthopedic skills and knowledge and experience and applying it to the neurologic population?
Mm-hmm. Yeah, I mean, for that question, it kind of just stems from like why I wanted to be in this type of clinic, anyways. Well, for one, I never really thought that they're each mutually exclusive. Just because someone has a neurological condition doesn't mean they also don't have orthopedic issues. So, I mean, to answer your question, I feel like I was doing that as a student, and then now I'm just more advanced into it, or have advanced training during my residency. So it's a tough question to ask. I would have to know a little bit more specific, or have a more specific question on how to answer that. But yeah, but
Sure.
pretty much capacity, so then they can accomplish their neurological impairment or conquer their neurological impairments.
Yeah, and it's really cool. And like you both said, with neurologic conditions, it's highly unlikely that, we're going to treat it for 6 weeks and it goes away forever. So you're really building that relationship over time with our patients. And that's kind of similar to why I chose PT also, because it's not like see you once, see you never again. Right? So we kind of build that relationship. That's what I'm getting from you two.
Mm-hmm. For sure. Yeah.
Awesome. So you two are both doctors of physical therapy. You've graduated from doctor of physical therapy programs. How do these programs, like Lincoln, your fellowship, Harrison, your residency, how do these kind of build upon the skills that you've gained in PT school?
Yeah, so I think, kind of like we touched on before, we're really sort of specializing within our field. So Harrison, he's specializing in orthopedics, getting that sort of expertise, but also, doing it in a specific subset of that population in a neuroclinic. For me, like we talked about, it's movement disorders. So building on, the clinical rotation experience I had here, kind of broadly spread across the neurological condition population. And really focusing in on all the different types of movement disorders. So, Parkinson's, Huntington's, dystonias, there's many types. And it's basically just taking the basic skills and your basic understanding of these conditions and then, applying it to the real world where patients are, in reality much more complicated and complex than your textbook kind of definition of it. So you really just start to gain that, like, from mentoring and from experience, like how to really manage these conditions and all the complicated things that make them difficult to manage that you don't really get just from like a quick 6, 8, even 16-week rotation in a clinic as a student. So that's the biggest thing. You're really like learning about the complexity and then how to actually use your skills, learning new skills and applying it.
Got it. So it sounds like to me, physical therapy school gives you the tools and maybe like the basics of like how to use them. But whereas here in residency or in fellowship, you're actually applying those tools in different ways. And for example, like the first thing that comes to mind is a screwdriver. Okay, yeah, you can probably twist it, but then using an analogy right here, you can probably twist the screwdriver and that might be how we're taught. But you come to residency or fellowship, you get that specialized training and you can use it to probably pry something open or use it in a different way that was not intended, correct?
And you get different sizes of screwdrivers as well, I would say.
Different sizes of screwdrivers, different sizes of tools that we get to work with, and different kinds of tools, different people.
You hone your skills, new ones.
Can you say that one more time, please?
You hone your skills and you learn new ones, I would say.
You hone your skills and you learn new ones. And I think that's a very succinct way of talking about residency and fellowship. That's awesome. Let's see. I know that we had a question regarding doing residency in California, or even fellowship. if you're an international. So can international licensed PTs join our fellowship or residency programs?
Yeah, if they're they have to be qualified as for a California state license as a physical therapist. So as long as they go through, for example, if they finish a physical therapy program in an international country, they would have to go through this application process to be eligible for a California state license. So as long as they go through that process, yeah, they should be eligible.
Awesome. So it's not just, okay, you have to be in California, you're born in California, you live in California, you do everything here. So as long as you have the California license, it doesn't matter where you're from, you can come here, you can study, you can learn, you can practice, as long as you have that California licensure, correct?
Yes, and then you would also have to be able to live here too and move. It's not a virtual program, it's just an in-person experience.
Right.
Got it. So I know that there's, what was that?
Oh, same for the fellowship, yeah.
Same for the fellowship, got it. Okay, because I've definitely heard of some programs where you can take some classes online and occasionally pop in for training, and then over time you accumulate your hours, and then you can just apply for the certification and take the test. But here, you're actually going through training in the clinic almost every single day, correct?
Mm-hmm. Yes.
Got it. All right. I think I just have one more question for the both of you. I'm just going through my list here to make sure that I got everything.
Did I answer your other question? I don't know if I missed it or if I didn't just say anything.
Lincoln might have answered that one.
Oh.
Yes. Well, let's see. I do have one more, and I don't see any more on the list, and I don't see any more questions in the chat. So, Harrison, you just started relatively recently here at Re+active. It was the beginning of September, I believe, the end of August?
Yeah, like August 30th.
Got it. Okay. And then when's the application cycle?
Oh, I don't really remember, to be honest. It's on the website, though. I believe it was I want to say like March was when it opened. You would just have to refer to the USC physical therapy website or PTCast. I might be, just in case I give wrong information.
Sounds good. Okay. And then for the fellowship, it's a little bit different though, right?
Yeah, the application cycle ends March 1st. So it's open, I think, whenever you want to start it. But the deadline is March 1st. And you would start then October of that year.
Got it. Okay. So I know that you've officially started in October, but you've been here a little bit before that though, right?
Yeah, I was working just as a physical therapist here after I graduated and waiting to start the fellowship, but yeah.
Got it, that makes sense. And then, so you mentioned that it's open at any time, so is the fellowship application open right now?
Open right now.
Where can people find the application?
It's on the Re+active website. If you go under education, it's a very large link. You can read more about the fellowship. There's a nice description of what exactly you do, what the fellowship was created for, and how to apply. You're going to need references, and all of that information in your application is due by March 1st. So that would be www.reactivept.com. That's the website, and you'll find it there.
Perfect. Okay. And then just to reiterate, for the orthopedic residency, specifically through USC, you would have to apply through the common portal, the rf-ptcast.org or .com. I can't remember off the top of my head.
Mm-hmm. That's correct.
All right. So I know you two both started recently, officially. What are your plans after?
Well, hopefully remain in this type of clinic and population. I find it very rewarding and very, I feel like I'm always learning. The the environment here is just top notch. And then furthermore, just expanding my skills internationally, especially in Vietnam. I have a lot of family members in Vietnam, so I would like to contribute my advanced skills there.
Yeah, in the long term, I think remains to be seen. But yeah, just like Harrison said, I think I will be at Re+active after the fellowship is completed. I'd like to continue working here. I think even after the fellowship is done, there's such a growth mindset, and there's so many amazing clinicians who are willing to help mentor, you and help learn from each other in neuro PT and movement disorders specifically. I can't really imagine a better place to be. So I'm going to be here. I'd like to also get more involved in education as well, for maybe related to movement disorders, and we'll see after that.
That's so awesome to hear. And it sounds like both of you have bright careers ahead of you. Thank you so much for taking the time to interview with me and take over Julie's Instagram.
Yeah, no problem. Thanks for hosting us.
And I just one more check. There are no more questions in the chat. Thank you everyone for joining in. We are going to log off for the night. Take care.
See ya.
Save the video, Jake.
I will do my best to remember.
Bye.